Beat with Dr. Benita Zahn.
The number of states with soaring COVID rates keeps growing. Testing is starting on vaccines. More children have been affected by a post-COVID syndrome. There have been more infections that went undetected than previously thought. Every day, there's something new regarding COVID-19. To help wade through some of the latest info is Dr. Eli Rosenberg, Assistant Professor of Epidemiology at UAlbany School of Public Health. Good to have you with us again.
Great, thanks for having me.
I almost don't know where to start. So let's start with the children. You were part of a paper that looked at 99 children who were affected by this post-COVID inflammatory, sort of like Kawasaki's disease. I think we've covered the ground, that it's been discussed. What are you finding there?
I think what we're finding is these children have a very serious and significant condition that occurs some weeks after their initial infection with SARS coronavirus 2. And I think what's important to emphasize is this is still a relatively rare condition for children, but it's very serious and requires a great deal of medical attention.
Dr. Rosenberg, how sick were these children initially with COVID-19?
That's a good question. I think that we didn't quite have all the data to fully describe back to the beginning of their illness. We know what would happen when they got to the hospital later with this situation. Many of them had cardiac complications, gastrointestinal issues, and many required to stay in the ICU, and unfortunately two passed. So
these were not kids who just had a mild case who were treated at home. These were very sick children.
That's right, but they showed up probably when they were hospitalized with this condition, MISC. It was probably some time after their initial infection, which may have been less remarkable. And it's really this second or later complication that really was the cause for alarm.
So that's the part that strikes fear in a parent's heart, is that they may just think their child has a run-of-the-mill cold, but then 2-3 weeks later, they're in crisis.
That's right. But again, I just do want to emphasize this is still a very rare complication. You know, a small fraction of total instances when children were infected.
Yeah, and some of these children had similar types of other underlying issues like obesity that adults would have if they're having more severe complications.
That's right. Yes, there's an interesting parallel to the to adults who face severe complications as well. That's right.
Dr. Rosenberg, there are people who are saying, oh, you know, the stuff that we're seeing in these other states, these flare-ups, not such a big deal. It's younger people. Yeah, the numbers are growing, but the death rate does not match it, so we don't have to worry so much. To that, you would say what?
I would say that's a very short-sighted view. I think what we're seeing here, where the sort of this leading edge of infections that we're detecting is among young persons, is frankly what we would expect with wide-scale testing. There's a number of contributors to why we might be seeing this current pattern relative to what we saw, let's say, in March in New York, when there was maybe more of diagnosed cases were older. I think the first is we have, in the beginning, we were really testing the sickest people, and that would sort of skew the distribution towards older relative to where we are now, where testing is more available. I think the other piece is that younger persons might be less vigilant after reopening and be first sort of grouped to go out in large numbers, whereas older persons might, in this affected region, might hang back a little more. But that's not a forever solution. Young people intermingle with older people, and what we're seeing now will echo into older populations probably in the weeks ahead, and those hospitalizations and deaths will follow in the days ahead, in the days and weeks ahead, unfortunately.
So very troubling. And before we call it an interview this time around, want to also talk about some research coming out of China indicating that people who were infected, the immune response when tested falls off. So we may not know who in fact was infected. Yes?
Yeah, I think that is a very troubling early finding. I'll just say that the study had a little over 30 symptomatic persons and about a little over 30 asymptomatic persons. So the total numbers in that study were very low. But you're correct. What is troubling is that what they found is that in people who are asymptomatic, so people not showing symptoms, they did not maintain a very long antibody response, let's say some weeks or months out. The timing of when they lose that response is unclear. It doesn't necessarily mean that those people have no immunity. There's many components to the immune system, and they were measuring some of those components, but not all of those. I think we need more studies. More studies are underway. I think during some of his remarks, Dr. Fauci referenced that there's going to be long-term studies going on in the U.S. To look at this very important question.
And Dr. Rosenberg, a lot of folks want to get away, take a little holiday this summertime, and I was discussing it with a colleague here in the studio, and he was going to go to one of the hot states to visit family, and he's not going to do that now. But for the rest of us, so maybe you want to go to Maine, Rhode Island, Massachusetts, Vermont. Should we? Shouldn't we? What's the recommendation?
That's a good question. It's very hard to navigate all the different messages that are coming from different sectors of the government. I would say first and foremost, it's very important to really listen to what leaders are saying here in New York. But I also think it's important to just be a little extra vigilant and a little extra protective. You know, even if we have a green light for a certain type of travel or vacation according to current recommendations, it's important to know that both our understanding of the science is evolving, and also that our ability to detect a problem always lags by a little bit of time. So even if it's okay today, it could be that there's some transmission in a location that is not yet showing up or detected. So I think it's okay. I would honestly err on the side of playing it safe, stay closer to home if you can, and really only take those trips that are truly necessary. And when you do so, please wear a mask and adhere to recommendations around distancing.
And swimming pools, yay or nay?
It's hard to give a clear answer. I think it's probably one of the more safer environments. However, don't go into a crowded swimming pool. I think, but the fact that it's outdoors, it's in a body of water, probably means you're pretty safe. But again, I would avoid a crowded pool situation.
Yeah, there's just so much cloudy area in all of this,
right.
And that's what makes trouble for a lot of folks. They stop listening to the messages, Dr. Rosenberg, because they say, on Monday you told me it was okay, Tuesday you told me it wasn't, Wednesday you said maybe. I don't mean you specifically, and that's part of the problem here, isn't it?
That's right. Well, I think what's challenging is many other diseases, I'll pick on HIV, where a lot of my work has been, the science evolved over the course of years, and recommendations evolved over the course of years. Here we have a very fast-moving situation, and the time frame for discovery and science and disseminating the best science really requires a longer time frame than is required for action. And so that's why we have sometimes overlapping or changing messages. It's truly we're trying to get the most current information out based on the best science, and it's very, very tricky.
Dr. Rosenberg, thanks so very much. I'm reserving the right to invite you back as a guest in the coming weeks. So much to discuss. Stay well. See you soon.
Thank you.
And thank you for joining us. Up next, the intersection of COVID and Lyme disease. We'll see you next time.